Oregon Health and Science University is the only academic health center in the entire state of Oregon. We are the only school of nursing that has a true statewide mission. Through our 5 physical campuses around the state, as well as our virtual programs and online, we seek to create access for nurses wherever they are in the state. We have 3 primary missions: education, research, and practice, and faculty who teach and practice, and they are scientists and scholars.
Hi, good morning. My name is Asma Taha. I am your nurse practitioner today. I came to OHSU 4 years ago to lead the pediatric nurse practitioner program. It was a new program that was started here. We try to engage students above and beyond the academic requirement of becoming a pediatric nurse practitioner. We want our students to be able to address what's going on nationally and how we can be advocates for children's health, for their families' health, and for their access to care.
A major area of our focus at OHSU is to instill in our students that they are leaders, that they are going to lead wherever they are. Urban areas, rural areas, frontier areas.
I grew up in northern Ghana. Because I grew up in the village, I have the passion for people who are in the local levels and in the rural communities. And that is my goal in the future, that I'll be able to go out there one day and serve the local communities and those underserved communities where there are immigrants, vulnerable populations, homeless people.
Every single time I interact with those young women, I think of myself. I believe this is one of the strengths of our program at OHSU, that we try to enhance empathy and encourage our students and our graduates to think beyond our local population.
Follow my finger.
They have the opportunity to experience social determinants of health, population health, health disparities, that they can then go out and effect change in making those situations better.
My experience in the ICAN program taught me truly how broad the role of a nurse is. We had real life stories of patients who had life-threatening consequences from medication errors related to limited English proficiency. I was able to advocate and improve medication safety for almost 200,000 Oregonians across the state. Senate Bill 698 requires pharmacies in Oregon to provide prescription container labels in both English and a readable language for patients with limited English proficiency.
The experiences that they have in the classroom, online, and in their clinical experiences allows them to contribute on a regular basis as a student, so that as they move into their professional lives, they're able to continue to do that.
I do plan to seek out a career here in Oregon. I've absolutely fallen in love with this state, and I think there's just so much opportunity here as a nurse.